Good morning, Dr. Blevins. How are you? Thank you so much for joining us today.
Hi, Kate. I'm excited to visit with you. I miss you. We haven't been able to get together in person for a little bit now because of the travel restrictions and everything. But with this technology, it's like you're sitting knee to knee with me right in my office. So this is really fun.
It is. And I missed you too. I'm excited for the day when we can get reunited in person. So first off, how are you doing in the midst of this COVID-19 situation? Are your family, your team members all staying healthy and safe?
Well, we are, it's interesting because I'm a very busy lady and I can't stand to just sit around. So the first day I stripped my closet and cleaned my closet, the first day I just had to stay home. And my closet looks like a designer house closet too. And it
Good for you.
may be short-lived. But my husband had to tease me because I got rid of about 6 bags of things, and it looks like I didn't take out anything. But it's not messy anymore. So that's me being in control of what I can control. But my work schedule, I'm used to working or traveling and lecturing, and obviously my April in office course is going to get canceled. So that's
Yeah.
kind of a bummer because it was our first one.
Well, so tell me a little bit more about the April course that you were doing.
Well, one of the things that I notice a lot when doctors talk to me is that as soon as they start ramping up their aligner-based practice, they end up getting overwhelmed with the volume of ClinChecks they do, and
Yeah.
that happened to me too. And so, one of my staff members that was a dental assistant for years in the ortho channel, I trained her how to help me with the ClinChecks. And now I actually have uh, 4 different ClinCheck coordinators helping 5 doctors because we have a multi-office practice. And what their job is to get the original ClinCheck back, the first one, and
Okay.
troubleshoot it and make sure that our prescription was followed, that there weren't any obvious errors, and get those fixed. And then the second ClinCheck comes back and they look at staging it for our practice so that IPR happens at our appointment sequences and things like that. So by the time I actually see a ClinCheck, it just takes minutes for most of them for me to approve them.
That's
So
amazing.
if you think about it, we used to have full-time lab people, and it's kind of a role switch where now I have more of a digital assistant helping me with it. And a lot of doctors are shy to train someone or they don't know where to start. So I've written a curriculum on now that I've trained multiple ones. I have it kind of dialed in how to get them up to speed pretty quick.
That's amazing. And what a great tool to share with so many other doctors, and what a great resource for you to be able to do that because we hear all of the time how long it takes to go through those, and Invisalign is such an amazing tool. So I think that's wonderful that you're providing that program, that curriculum.
Yeah, the other thing we're working on now, and maybe we'll have to add it to that curriculum because we've been forced to expand our virtual consultations. So not just consultations for new patients that are still, believe it or not, inquiring about orthodontic care, thank God,
Woohoo!
but also our patients out there that need to be assessed, how treatment's going, make sure things aren't getting off track, and even our bracket and wire patients. We've got patients out there in reverse curve wires and all kinds of things that need to be monitored. So we've got a core group of staff that is actually looking at that and perfecting that. So my goal is by the time we get done with this virus crisis, that we have that polished that and come out of this better. That's my
Yeah,
goal.
that's wonderful. And you just hit on it a little bit, but this is a time of fast-paced change and a lot of uncertainty. So, what steps, in addition to kind of what you just mentioned, is Minnesota Orthodontics taking to provide patient care, staying in communication with the patients and their families?
Well, I have a business partner, and we both wear very different hats. So I'll just touch a little bit about what she's been doing. She's been contacting all our landlords and banks and things like that, and seeing if we can get deferred payments on our uh, revenues that are not coming in. We're going to have a cash flow crunch for a while.
Hmm.
Looking into unemployment laws and things like that so that we can protect our staff and try to keep them up to speed with what they should be applying for, what we're going to be able to help them with, and rotating different people through the office so
Yeah.
if they can get some different hours and things like that. So she's pretty much wearing that hat. The hat that I'm wearing is we have done a lot of dental monitoring with the dental monitoring company, and I really, really like it.
Yeah.
But now Invisalign has actually launched their own virtual care platform, and so we're learning how to use that as well. Some nice things about it is that it actually uses the Invisalign doctor site. And
Great.
photos get uploaded to that, and the patient communicates with you through that. So that could be a real advantage. So we're going to have to weigh advantages and disadvantages this next week or so and
Yeah.
decide which platform we're really going to stick with.
Awesome.
Um, but yeah, I've been doing virtual care visits for quite a while. Our office, 13 locations, we've divided up into different hubs. So my hub is a 3 office hub, and we beta test things typically here at my office. So for about the last year, I've been working on uh, different kinds of virtual assessments with cell phone pictures and and making a video to teach patients how to take photos with a spoon and all kinds of things like that. And it really goes really smoothly, and patients love it. So what's changed dramatically is now, rather than get it to perfect, we're going to have to launch it when it's really good, you
Right.
know because
Right.
we were earmarking having it up and running and before our June rush of summer patients.
Hmm.
But we'll just launch it as soon as we get back to work now.
That's great. And sometimes, I mean, sometimes it is nice to be forced into moving forward, as
Oh,
opposed to waiting
change.
for perfection.
Yeah, I embrace change. Change is typically fairly easy for me. It's not for everybody. So I've surrounded myself in my hub with talented people that are my assistants and my ClinCheck coordinators and my TCs that don't mind change. But
Hmm.
that doesn't mean we don't have other doctors in our group and other staff members in our group that fall in a different place on that spectrum.
Right.
So we have to get it to where we work the bugs out of it. So when we introduce it to the other offices, um, it feels comfortable to them.
That's great. That's great. And this pandemic took patients' wants of fewer office visits, increased convenience, virtual consults, and really made it into a necessity overnight. So you just touched a little bit on how you're adapting to stay successful now by making those quick changes. What other changes do you think you'll have in the future as well?
Well, there's changes happening to all our protocols. We're re-examining them one by one. And as you know, I work with you pretty extensively with the V Pro product, the high
Mhm.
frequency vibration product. And, talking about beta testing it, we beta tested it in my hub for quite a while.
Yeah.
And we've launched it practice wide now where majority of our patients, certainly older teens and adults, use the product. And what we're finding is that when we talk to our patients during their virtual exams and things like that, it's a real great tool for keeping patients on track. If they're having to do their V Pro every day, they're conscious of wearing their aligners every day. They talk about less discomfort. They don't have some of those same issues. So yeah, we're looking at all of those. We hadn't really used it for our bracket and wire patients yet, but we're seeing such positive results with our aligner patients that it's certainly something we're looking at adding to our bracket and wire patients as well.
Awesome. Wonderful. And in the midst of all of this, is there any difference of how you're handling new patients versus current patients versus patients who are in retention?
Well, yeah, our new patients, we used to get them into the office and wow them with our, state of the art facility and our scanning and our techiness. And we can't really get them in the office right now.
Right.
So we're trying to do our social media advertising of our virtual consults. One of our associate doctors and one of our rockstar TCs are screening all those inquiries and setting up video conferencing like this and meeting
Great.
people and letting them know, what kind of treatment we would be able to do and giving them a guesstimate on costs. And of course, without a scan and without x-rays, we can't really onboard those patients properly, but we certainly can get them somewhat committed, let them know like a lot of orthodontists, we're offering some discounts now if they commit during this time while
Great.
we're a little bit lull. And then as soon as we can get them in and get them actually started.
Perfect. And what about your current patients? I think you mentioned something about some Monday drop-offs and some drive
Oh
around.
my gosh, one of my wonderful chairside assistants and I spent the whole day yesterday driving around. I guess maybe about 5 hours in the car together, dropping off new start aligner bags, retainers, all kinds of things. And wow, were our patients really appreciative. They loved it. My only concern is when we go back, they're going to expect that all the time.
Right.
Which, maybe that's a model we have to explore because dropping it off at the door and seeing their smiley face and them trying their aligner on. And, we were in masks and gloves, just to
Yeah.
be overly cautious. But, and we looked at them through their screen door glass, took a photo with my cell phone and went back to the office and loaded the photo in their chart. But yeah, if you had asked me if I would be doing that a month ago, even, I would have said maybe in a decked out, SUV type motorhome, because I've seen that before, or even in a
Right.
fancied out minivan. But gee whiz, this was so low tech, but so highly appreciated.
Yeah, that's amazing. And it's so great that you guys can have that one-on-one contact with the patients and go the extra mile for them. So kudos
Yeah.
to you too for going to do that. That's wonderful.
Well, there was a little bit of selfishness in that too, because all those patients for those deliveries aren't going to be patients that are backlogged for that particular appointment at our office either when we start back up. And we are going to be um, uh, a little overwhelmed when this opens back
Yeah.
up, and maybe compounded by the fact that we might not be able to see the same volume depending on the mandates for PPE and distancing that might still linger even after we get back to work.
Right. And when you do get back into the office, what precautions are you planning to take for your team and for yourself to make sure that you are all staying safe and healthy?
Well, Kate, that's a really good question. And in a perfect world, which we know this is not, we would be able to obtain the 95N masks or whatever they're calling them. We'd be able to have disposable gowns
Mhm.
and maybe see patients in every other chair, especially in an open bay situation. Um, well, it's availability. We don't know that we have those things. So certainly hand hygiene, wearing the mask that we do have. I already for a lot of things, take attachments off with a debond plier. So I'll try to minimize creating any kind of aerosols or dust particles that might be infected from occurring. Maybe I'll put my bracket debonds off a little bit longer because, you know, those are things that can create aerosols. But a lot of it's going to be what the science says and what the recommendations are from those agencies that say what we can do. I mean, let's face it, we practiced for many, many years and we stayed healthy the way we were doing it, sort of, I guess, what you might call old school versus what people are saying we might have to do in the future. And I don't want to err in the other direction of being so cautious that we can't function and can't help people either.
Right.
So we'll just have to see. But once they get a vaccine for something like this, which they're saying could be maybe 18 months from now, once that happens, I think, you know, I don't know that we'll ever go back to business as normal, but we might not have to be quite so cautious.
Right. Right. Wonderful. Well, that's great advice for everybody. Tell us one of the best things that has come out of this pandemic for you, personally or professionally,
Oh,
other than
wow.
cleaning out your closet.
Yeah. From a family standpoint, my kids are from the ages of 18 to 25. And we've been together putting puzzles together. We've been together playing board games and things like that. You know, not all day. They can't stand the parents that much. But we are getting some of their time that normally we weren't getting because, you know, one's in dental school, one just graduated from hygiene. My high schooler is really busy. So those kind of things are treasures that make me really reevaluate slowing down and spending time like that if we can get them to do that, because we've really enjoyed that. My husband, Tom, is a great cook.
He is. I can
I
vouch
got to
for
be
that.
very careful not to put on a ton of weight because he's making meals every night. So that's how he's relieving stress, you know. So I'm very well fed. We have some really nice wines in the house. You know, I gotta watch that a little bit too. But from a professional standpoint, the things that are fun is that I've seen my team really step up to the plate and help our business out. And from the bottom of my heart, I'll never forget that, or I'll always appreciate them for that. From going door to door, helping me, to being in the office, answering phones, to working from home. My ClinCheck coordinators are working from home, which is awesome. And my HR person is working from home, but she's studying all the laws and looking into things.
That's amazing.
My financial person is looking into what bills we can defer. They've really stepped up to the plate for us, and I always appreciated them, but not at the level that I do now. So from that standpoint, I'm thankful for this because it really brings their talents to light.
That's wonderful and brings everyone together. So that's amazing. Any final pearls or words of wisdom you like to share with this very tight-knit ortho and dental community?
Yeah, you know, stay on your Facebook groups and things like that. We take solace in hearing from others around the world that are living through this as well, and that we're all in this together. Two things that I've read recently on some of the groups that I'm in. One was the realization that Anne Frank and those like her survived way worse isolation and fear and persecution than we're dealing with now. And it put it in perspective for me, and it told me to, you know, put my big girl pants on and not feel sorry for myself. And then another doctor put a poem out about the world healing, that something happened and we had to stop and reevaluate our relationships, and it repeated, and the world healed. Again, I can't think of the author, but those kind of things sometimes I think will hone in your perspective and trying to keep myself sane, I'm looking at how I can come out of this better. And that's how I'm going to stay focused and positive and upbeat. Now, talk to me again in a week. We'll see how I'm doing. But
Oh, I know you. You will have a new skill. You will have upgraded your
I'm learning.
skills.
I'm learning Chinese. You know,
Perfect. Look
I've
at
got the
that.
Duolingo app and my earbuds, and I have a
Amazing.
son. My youngest, 18-year-old, is from China, and if that kid in 2 years, 3 years can be fluent in English, I might as well learn some Chinese. So
Yes.
I've got a tutor in the house, and I've got a really great app for it, and I want to get better at Chinese. So
That's
that's what
perfect. I
I'm
think that's a
doing.
great goal. Well, I hope next time we do this, you can speak a couple words of Chinese to me.
Oh, okay. Um, yeah, he's taught me a little bit of slang. I can say some things on air, maybe, I don't know, but
We'll
um,
wait for next time on that one,
I
but
can say hello and goodbye for sure.
perfect. Perfect. Well, thank you so much, Dr. Blevins. I really appreciate your time today and sharing your advice and what you have been doing at Minnesota Orthodontics and your wisdom with the rest of the orthodontic community. I
Well,
honestly believe
let's
that this is what we all need right now. So thank you.